Good morning, and thank you for joining us for SBB Live. I am your host and the publisher of Seniors Blue Book, Amanda Barton, and I'm delighted today to bring on one of my partners from Snead Eye Group, Dr. Allison Coll. How are you this morning?
I am doing well. How are you?
I'm good. Thanks for asking. So I wanted to just introduce our listeners and our readers to the actual physicians. So tell me a little bit about yourself and where you're from, how you got into this beautiful industry of all about eyes.
Sure. So I grew up my whole life. I came from outside of Philadelphia, so a little bit more north than where we are now. Growing up, I've always been very, very nearsighted. So without glasses or contacts, I can't really see past my hand here. So that's how I got interested in, the field of eye care and optometry, ophthalmology. So growing up in high school, I used to work for my own optometrist, after school and through college, things like that. And I went to Penn State University for my undergraduate degree, and then I went to Pennsylvania College of Optometry for my optometry degree. During that schooling period, we were able to kind of see other parts of the country through rotations. So I started going south just because I hate the snow and the cold. And I worked my way all the way down to Florida. So I did my residency in Gainesville at the University of Florida and their VA hospital. And then I landed here with Snead Eye Group, and I'm super happy to be down here.
Wow, that's awesome. It's good to have a personal story to go with your mission on what makes you so passionate about what you do.
Yeah.
Being here in Southwest Florida, I'm sure that you're used to working with the geriatric population. Talk to us about why it's important to continue getting that annual eye exam and some of the benefits, especially as you're aging.
Sure. So one of the coolest parts of being an eye care provider is that when we look into the eye, we're actually able to see the overall health of the rest of the body as well. So when we dilate your eyes, we can see blood vessels, we can see changes in regards to, say, diabetes, high blood pressure, high cholesterol, things that people don't really think about because we're just looking at the eyes, but we can tell a lot about the rest of someone's health. And those things are all important, as we're getting older, to make sure that things in the body, not just the eyes, are well controlled. And then, of course, we have diseases related to the eye that pop up a lot more as we, get a little bit older, have some more birthdays here and there. So things like cataracts, glaucoma, macular degeneration, all things that if you have your routine eye exams, we're able to see them early. And the earlier we find things in the eyes, the easier it is to treat and manage them. So just stressing the importance of coming in to make sure things are looking good.
Yeah, for sure. Now, what advice would you give to someone that is, a candidate potentially for, let's say, macular degeneration, for example? Are there any dietary, restrictions or advice that you would give to keep your eyes healthy and safe?
Yeah, absolutely. So one of the biggest risk factors with macular degeneration, obviously it's called age-related macular degeneration. So we can't really escape that. Getting older is just, part of going through life, but there are other risk factors. Smoking is a big one. So trying to quit smoking, which is hard, but it's good to keep the health of your eyes. Diet is another one that we look at. So lots of leafy greens, lots of good nutrients. And then there are some vitamins that have been kind of studied and approved for certain patients if they meet the criteria for them. So certain vitamins that a patient would take maybe once or twice a day can help to protect the health of the eyes as well.
Perfect. And I know that, as we get older, there are a lot of reasons to look at your eyes, your ears, for balance and things of that nature. What advice would you give for our geriatric population to continue being independent and aging in place when it, is related to their eyes?
Sure. I think when we look at all the senses that we have, hearing is very important. Smell, taste, all of those things are obviously vital, but the eyes, they're important as well. I might be biased, but I think it's one of the more important, senses that we have. It allows us to live our life. It allows us to be more independent when it comes to driving and, just doing routine daily tasks. Eyesight, it's to me, one of the most important things to keep healthy. So I can't stress that enough, just the importance of coming to see your eye doctor.
Well, and I think if one of your senses is off, it kind of knocks the other ones out of balance too.
Yeah. Yeah.
So, a trip hazard could be a lot more serious if you are having seeing and or hearing or,
Yes.
vertigo issues. So,
Yeah.
I do think they're really all tied together.
Agreed.
Um, yeah, so it was really, really nice to get to know you virtually, and I'm excited to introduce you to our readers and our viewers out there. And I just want to thank you so much for your valuable time this morning, Dr. Call.
Of course. Thank you so much for having me.
Absolutely. Have a